Imagine you are going for a walk in the park and you see someone just fall unconscious. Do you have the knowledge to save their life? This video is here to inform you on what to do when arriving on the scene of a victim, how to test for consciousness and unconsciousness, and what to do in both of these different types of situations.
The first thing you should ever do is always check your surroundings. Look for broken glass, debris, fire, or anything that can harm you before trying to save the victim. Your safety is also important. If surroundings are too extreme to proceed, call 911 immediately. If your surroundings are clear, continue by moving towards the victim as you clap and yell or by tapping them. This will allow the victim to respond if they are conscious. If they respond, keep them still and in their current position, asking if they are okay. You can ask them a series of questions to test for any head injuries like a concussion. This can be done by asking them simple questions like what's your name and when is your birthday. Be sure to call 911 and they can take over to check for any non-obvious injuries. Now what happens if there is no response from the victim? Here is what you do. Perform a quick body scan for any blood loss or injuries. Place the head back using the head tilt technique. This is done by placing the palm of one of your hands on their forehead and using 2 fingers from the other hand, placing them on the mandible or the chin bone and pushing back so the head is perpendicular to the ground. Listen through the casualty's mouth and look for signs of breathing from the chest for 10 whole seconds. This is to ensure that the casualty is actually unconscious and not just taking a nap. Check the radial and carotid artery for a pulse, although this step is assumed to be absent if breathing is not present. Now here are all of the steps in order. If there are no signs of breathing or a pulse, check for bystanders that can call 911 for you so you are able to begin CPR immediately. If there are no bystanders, call 911 as fast as possible and proceed to CPR. If they are not breathing and have no pulse, make sure to determine your surroundings. If you are outside or don't have access to an automated external defibrillator, continue with cardiopulmonary resuscitation, also known as CPR. CPR is important to proceed on someone who is not breathing to ensure oxygen is being delivered to the brain. If there is a second person available, have them assist with the CPR to allow switches of compressions and breaths every 2 minutes to reduce fatigue. CPR steps go as followed. Deliver 30 chest compressions by placing the hands in the center of the chest on the sternum. Have one hand on top of the other. You should be pushing hard and fast. Push down at least 2 inches with the heel of your hands and as fast as 100 compressions per minute. Once the 30 chest compressions are completed, provide 2 rescue breaths by using the head tilt technique and be sure to allow the casualty to exhale after each breath. Now here is a clip of 2 full cycles of CPR being performed. Continue performing CPR until EMS arrive or you are too exhausted to continue. If they are breathing and have a pulse but are unconscious, continue with the following. Check once again for any blood loss or injuries. If the body seems clear, roll the victim into semi-prone position by the following steps. Place one arm above their head straight. Place their other arm folded over their body so their hand is cradling their head. Reach across the casualty and bend their knee upwards to act as a lever. Roll the body so the bent knee hits the ground. This position is going to prevent choking on anything that could come out of the casualty's mouth. Once they are in this safe position, be sure to call 911. If you are interested in being able to perform any of these actions shown in this video, as well as treating other possible complications such as drowning, choking, burns, bug bites, or any first aid and CPR performances, I would strongly recommend taking the first aid and CPR training courses at either Red Cross or Sage Vital Signs. Call either of the numbers on the screen and you too can be qualified to save a life.